Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's June 25th, and we have a lot to talk about. And today we're going to be talking about something that doesn't get discussed very often, but it should. If you're a regular listener, you know that my wife Jean is living with what is at this point a very advanced case of progressive MS. As Jean's symptoms started becoming more pronounced and her level of disability began to increase, I stopped working for about 10 years to serve as her primary caregiver. But that's not exactly what we're going to be talking about today. And if you're interested in learning more about my journey as Jean's caregiver, you can check out a documentary that tells that story by visiting the RealTalk MS website at realtalkms.com and clicking on the tab that says Seeing MS from the Inside Out. But today, I want to focus on a specific aspect of being a caregiver for someone with progressive MS or Alzheimer's disease or really any chronic illness that progresses, that gets worse over time, and that doesn't have a cure. When you hear or read something about caregiving, you typically hear that there are more than 40 million caregivers in the United States alone. You might hear about the financial stress that goes along with being a caregiver for someone with a chronic illness. You might hear that caregivers tend to do a bad job of taking care of themselves. All of this is some of what you hear all the time. But what you don't always hear about is the psychological or emotional toll that caring for a loved one with a progressive illness can take, because that can become a very uncomfortable conversation. And I should probably point out that what we're talking about may have less to do with being a caregiver for someone with a milder case of relapsing remitting MS, someone who may have very few symptoms. And it's not that there still isn't a tremendous amount of stress and strain and anxiety that goes along with living with any chronic and incurable condition. And MS has that special, added punch of being unpredictable in terms of which symptoms any individual might have, or when a new symptom might all of a sudden appear, or when the disease might progress. But today's discussion is really about the psychological journey that a caregiver takes when it feels as though their loved one is starting to disappear right before their eyes. But at the same time, that person is also still very much there. My guest today is Dr. Pauline Boss. Dr. Boss coined the phrase ambiguous loss to describe this type of loss, and the concept of ambiguous loss has evolved to become an entire field of study in psychology and family therapy. Dr. Boss has studied ambiguous loss, taught university students, practiced as a clinician, and trained family therapists, psychologists, and counselors around the world to help individuals and families suffering from the trauma of ambiguous loss and this form of grief that doesn't end. If you have friends or other family members who are caregivers for someone with progressive MS or any chronic progressive illness, I'm going to recommend that you let them know about this episode of the podcast. After spending more than 20 years as a caregiver, I've never heard anything that Dr. Boss talks about during our interview discussed in any other forum before. We're going to talk about what ambiguous loss is and the specific steps that a caregiver can take to develop the resilience that's necessary to live with ambiguous loss. I think that listening to my interview with Dr. Boss can be incredibly helpful to anyone caring for a family member with progressive MS or any other chronic and progressive illness. But before we get to my conversation with Dr. Pauline Boss, there are a few other things that you should know about. The blood-brain barrier is a network of cells that protect our central nervous system by allowing things in that our brain and spinal cord need, like oxygen and glucose, and keeping out harmful substances in the bloodstream like bacteria, toxins, and immune cells. When someone has MS, some of their immune cells are able to penetrate the blood-brain barrier. These cells aren't used to being in the central nervous system, and when they kind of look around and see myelin, the fatty cells that coat our nerve cells, well, they identify that myelin as a threat, and they attack. Just like in other parts of our body, they attack bacteria that might cause an infection. Well, this attack that leads to demyelination leads to nerve damage and MS symptoms. Several of the disease-modifying therapies for MS, including Tysabri, Gilenya, and Siponimod, act in some way on the blood-brain barrier. Well, a team of researchers at Ben Gurion University of the Negev in Israel and Cedars-Sinai Medical Center in Los Angeles have for the first time succeeded in duplicating a patient's blood-brain barrier using stem cells from the patient to create a blood-brain barrier on a chip the size of a AA battery that can be used to develop personalized medicine and a whole new way of researching MS and other neurological conditions like epilepsy, Alzheimer's disease, and Huntington's disease, which have all been linked to some sort of defect in the blood-brain barrier. By combining a patient's stem cells with the technology that allows scientists to create an organ on a chip in the lab, MS research, drug screening, and the ability to better personalize a treatment to an individual patient all become more viable. And if you'd like to learn more, you'll find a link to the research paper in today's show notes. Fall prevention is important to people living with MS. About half the people with MS fall at least once during a 6-month period, and fear of falling just gets in the way of living your life. Last week, my guest on the podcast was Dr. Laura Rice, and we talked about Dr. Rice's research project that's looking at a fall prevention program designed for wheelchair users. And while we don't always connect the idea of falling to someone in a wheelchair, well, that's real. But what about the people who are living with MS who don't use a wheelchair for mobility? When it comes to fall prevention, a program called Free from Falls has been shown to provide immediate and 6-month sustained improvements in mobility, balance, and a reduction in falls. But Free from Falls, the program itself, well, its attendance is always limited by access to the class at a given time and location, by its cost, and by the availability of trained facilitators. So a team of experts from the University of Virginia, Oregon Health and Science University, and the University of Alabama, Birmingham developed and evaluated an online web-based version of the Free from Falls program. The Free from Falls online program was tested among a group of 30 people with MS who had reported falling at least twice in the previous 2 months. 70% of this group was female, and 73% had progressive MS. The median EDSS score was 6.0, and the average age was about 56 years old. Now, half of the group went through the Free from Falls online program, and the other half served as a control group. The Free from Falls online program included 8 weekly sessions, each with an instructional and an exercise component. Participants in the control group were given a brochure about minimizing the risk of falling. Well, the results of the study showed that the participants who went through the Free from Falls online program were slightly less likely to fall than the participants who were in the control group. So, somewhat positive results. But positive nonetheless. So perhaps what's needed is a larger, fully powered, randomized control trial among people living with MS. And if you'd like to learn more about this study, I'll include a link to the study results in today's show notes. We talk a lot about research on the podcast because I believe that good science is the engine that creates a future. But if you're someone who's living with MS, or if you're an MS caregiver, you can play an active role in MS research. I hope you take a moment to think about becoming a part of I Conquer MS. By providing your own health information to the I Conquer MS database, you can not only participate in MS research, you can propose research, you can send along questions to the researchers, and you can really be a full participant in patient-powered research. You can even suggest topics for us to talk about on RealTalk MS. So I hope you're going to consider becoming a participant in I Conquer MS. And if you'd like to find out more, you'll find a link in today's show notes. When you're living with MS, sometimes just getting to an infusion center or an appointment with your neurologist can become challenging. So I'm happy to tell you about a program from the Multiple Sclerosis Foundation and LIFT that might make getting to your next MS care appointment a little easier. Through the MS-focused Transportation Assistance Grant, the MS Foundation will pay for your LIFT ride to and from your MS care appointment. And we talked about this program when it was being piloted in Florida, and I am so glad to see it rolled out to everyone now. There are a couple of requirements. Obviously, you must have a documented MS diagnosis. You also need a cell phone that supports text messaging so that you can use it to contact LIFT. And you have to be able to transfer in and out of a car. Unfortunately, very few LIFT drivers have wheelchair transport vans, and the drivers aren't permitted to assist with your transfer. You can, however, bring a support person with you to help with that transfer. Like all of the MS Foundation's programs, this program is need-based, so you'll need to apply either online or you can call them and they'll mail a printed application to you. If you'd like to learn more or apply for the program online, you'll find a link in today's show notes. At the top of today's podcast, I said that this was a special episode of Real Talk MS because we're going to talk about a subject that's rarely discussed but is so important. If you're an MS caregiver, I hope you already know how important self-care is. Taking care of the caregiver is vital to being able to take good care of your loved one. But conversations about self-care tend to focus on things like caregiver respite, being able to take a break from your caregiving responsibilities. I think that self-care starts with understanding why caregiving can take such a huge emotional toll on a caregiver, and then understanding how you can best move forward as a caregiver in spite of that emotional toll. To do that, especially if you're caring for someone as their MS progresses, well, to do that requires that you develop an understanding of ambiguous loss. My guest is Dr. Pauline Boss, who not only coined the phrase ambiguous loss, but who has spent her career teaching university students, practicing as a clinician, and training family therapists, psychologists, and counselors around the world to help individuals and families suffering from the trauma of ambiguous loss and this form of grief that doesn't end. In a moment, we'll meet my guest, Dr. Pauline Boss. When a loved one dies, we of course mourn the loss. But there's another type of loss that caregivers can face, and this might be especially true if you're caring for someone with progressive MS, where there's no recovery, no remission, where the symptoms of MS can multiply in unexpected ways and can only get worse over time. Dr. Pauline Boss coined the phrase ambiguous loss to describe this type of loss, and the concept of ambiguous loss has evolved to become an entire field of study in psychology and family therapy. Since 1973, Dr. Boss has studied ambiguous loss, taught university students, practiced as a clinician, and trained family therapists, psychologists, and counselors around the world to help individuals and families suffering from the trauma of ambiguous loss and this grief that doesn't have an end. In 1999, Dr. Boss's most famous book, Ambiguous Loss, Learning to Live with Unresolved Grief, introduced the concept of ambiguous loss to a wider audience. And in 2011, Dr. Boss's book, Loving Someone Who Has Dementia, was published. It's a book that was written explicitly for family caregivers and paraprofessionals. Dr. Boss's work has garnered a number of prestigious awards, and today she's an emeritus professor at the University of Minnesota. Welcome to the podcast, Dr. Boss.
Thank you very much. My pleasure.
Perhaps the best place to start is defining our terms. What do we mean when we talk about ambiguous loss?
Well, unlike death, when there's a death certificate and official verification of person moving from life to death and transformation, ambiguous loss means a loss that has no verification. There is no certainty that death has occurred or that the person will come back again as they once were. So it's a loss that has no certainty. With a death, you have certainty regarding an official verification. With ambiguous loss, there is no assurance that the person is as they used to be, coming back, or what their status is.
And are there different types of ambiguous loss?
Yes. There are two types that we've identified. The first type is when the person is physically missing, like soldiers missing in action or people who have been kidnapped. I believe that your audience is more interested in the second type of ambiguous loss, which is not physical. It is psychological ambiguous loss. And that is where the body is still present. You can touch the person. They're still there in front of you, but their mind or their health, condition of health and the way they used to be is changing. So that's a more complex kind of loss, where sometimes they come back as they used to be, strong and lucid, and then again they're fading away and not as they used to be. And so it's a loss of what used to be, and there's an uncertain trajectory of where it's leading to. That's a very difficult kind of ambiguous loss, and I call it psychological ambiguous loss.
You know, my regular listeners already know that my wife Jean is living with very advanced progressive MS. And as her caregiver, I can recall two specific moments that I sort of connect to this idea of living with ambiguous loss. We know MS causes cognitive decline. And as I recognized that this was becoming more pronounced in my wife, I had to come to terms with the idea that each of us could no longer have an equal vote when it came to decision making.
Yes, it makes it topsy-turvy, doesn't it? You marry each other having an equal relationship, or else a relationship that was differentiated. But now it's topsy-turvy. It's the person who is healthier has to be totally in charge.
Right. And as much as I wanted to honor the person she was, that moment of realization kind of forced me to acknowledge that in a really important respect, Jean was no longer that person.
Yes. And it's a very difficult decision to make, isn't it, for you? It's the shifting of roles, shifting of your identity, which is one of the pillars, one of the 6 pillars of developing resilience to live with ambiguous loss, is to shift your identity. And we don't like to do that, especially if it's not our idea. And all of a sudden, you are the major leader, the major decision maker, the major director of the couplehood, the family, and it didn't used to be that way, right?
Exactly. And as I made that realization, it kind of led me to perhaps a more profound moment for me, certainly one that had its own challenges. Up till that point, Jean had suffered significant physical disability, but as her cognitive function was being impacted, to me, it was as though the person I had known was beginning to disappear right before my eyes, and yet she was very much still there.
Yes, and that's confusing, isn't it? It's, how can I say, ambiguous loss is in fact very confusing for the brain. The brain does not like ambiguity. And so people suffering the way you have been as the caregiver, whose loved one is in fact fading away slowly in front of your eyes, we try to make sense of that. Our brains try to make sense of that. And the fact is, it doesn't make sense. And so we are trying to make meaning out of meaninglessness. And that requires a sort of new way of thinking. It is not rational, is what I'm saying. And clearly, making meaning out of meaninglessness is not a rational assignment. And yet it's the assignment you're asked to deal with. Does that make sense to you?
Well, it makes complete sense. And in fact, as I read your book on ambiguous loss, when you mention the meaninglessness of that situation is its meaning, it just stopped me.
Yeah. The fact that it's meaninglessness is the meaning. It's paradoxical thinking, isn't it? And we're not used to that, at least from my culture, which is Swiss American Protestant ethic, and then graduate school on top of that. I've been trained to find answers to a question, to find clear answers to a question. And here we're faced with a question, is my loved one here or gone? We're faced with a question that is irrational and chaotic in many ways. And so we have to think in a less linear way than we have been trained. We have to think less about being mastery-oriented. That is, that if we work hard enough, we can solve any problem. Well, I'll bet you're working really hard and you still can't fix this problem.
Exactly right.
So, what we need to do then, the only option we have is to change our way of thinking about the problem. And the way to think about the problem is to accept the paradox of absence and presence. She is here and she is also gone. She is both here and also gone. We call that both and thinking. It's more dialectical, both and thinking. And it tends to reduce the stress of caregivers and people who are struggling with this kind of psychological ambiguous loss that MS can bring. He is gone, but he's still here. That's as close to the truth as you're going to get. She is gone and she is still here. That's as close to a true statement as you can get right now. And so you embrace that paradoxical statement because that's what it is. If you go to either absolute, she is gone, she's totally gone now and out of my life, that's not a real truth. Or if you say, she's just as she used to be, she's still here, that's not an absolute truth either. So you're in the middle shadowland, I call it, of she is here and also gone.
Well, I think my passport has been stamped by Shadowland any number of times lately.
I'm so sorry. I know some of what you're experiencing, not entirely, but I wish you strength. It will take strength for caregivers to live with this kind of ambiguous loss. It can happen with other things besides chronic disease. It can happen with addiction, but there is a difference because a person who is addicted can go into treatment. So there is an option there, whereas with diseases that have no cure at this point in time, like Alzheimer's disease and MS and so on, you can't send the person off for treatment. So it's a very difficult kind of situation, and it creates a chronic kind of traumatic loss that goes on, and therefore your grief does as well. You grieve along the way,
you mentioned chronic trauma, and that's something I kind of wanted to get into a little bit because we read an awful lot lately, perhaps more than ever, about this concept of resilience. And most of the things that I've read about resilience deal with the concept of finding resilience or developing resilience in the face of acute trauma. But the chronic trauma that a caregiver for someone with Alzheimer's disease or progressive MS will face, it isn't an acute one-off experience. So how does this concept of building resilience relate to ambiguous loss?
Well, it's a long journey, as you say. It's not a one-off. A lot of the trauma is based on post-traumatic stress. In the case you're describing with ambiguous loss and chronic illness, there's nothing post about it. It goes on and on. So yes, you need a different kind of intervention. Neither grief therapy nor PTSD treatment works with caregivers of these long-term chronic illnesses. What we have discovered is 6 kinds of pillars, guidelines that seem to work for trying to make sense out of the meaningless loss kind of losses that you have to face. And the first one we already discussed is finding meaning, the search for meaning. And the first step to make sense out of it is to give it a name. And the name is ambiguous loss. So at least you know what you're dealing with. You can't cope with anything until you know what the problem is. And so giving the problem a name is the first step. And then I talked about using both and thinking is probably the only way you can make sense. You can find meaning out of being a caregiver in this situation. The second is tempering mastery. That is, we tend, and I talked about that when I said we think we can solve any problem if we work hard enough. That's not the case here with caregiving. Caregivers work very hard, but they need to redefine and help themselves as well because, as you know, caregivers of chronic terminal illnesses like Alzheimer's disease die at a rate 66% higher than their same age group. So caregiving can be very dangerous for your health. And so you have to empower yourself, which might mean getting help, taking respite care, taking care of your own health, as much as helping the person who is ill. The third is reconstructing your identity, and we talked about that. And when you talked about your personal situation, about the roles that you play, you know, who am I now in this couple or family now that my loved one is ill? And that may change drastically regarding roles and who you see yourself as. After long-term ambiguous losses, especially in the field of dementia, people will even ask me, am I still married if my loved one hasn't known me for 10 years? And those are not black and white answers. And sometimes it's a both and answer. You have to continue to honor your partner. We take an oath when we marry, in sickness and in health. But also, you can go out to dinner with somebody else. You should join book clubs. You should go golfing. You need to have a social life or your own health will be in jeopardy. So there's a both and answer about, yes, you're still married, but you also need to take care of yourself, which means you may not go to the nursing home every day, or you make some time off and hire someone else to come in while you go golfing, or have dinner with friends. The next one is normalizing ambivalence, and ambivalence is a normal outcome of ambiguous loss. That is, there will be times of anger and there are times of joy. There may be times when you even wish it were over, which then causes a great deal of guilt because you're essentially wishing that person would die, I suppose. Just it's better to talk about that with peers, with other caregivers, because you'll find out it's quite normal. And if you don't talk about it, it's more dangerous than if you talk about it with someone else. So I encourage you to talk about it if those are the normal feelings we all have if we're feeling trapped by caregiving. And then the last two are about attachment. The attachment changes, but you still honor and love that person, but you need to begin attaching to friends outside of that circle just to maintain your own health. And finally, you discover new hope. You have to start thinking about new hopes and dreams when your caregiving is over. And sometimes just thinking about that can give resilience to a caregiver. You don't act on it now, but you think about, once this is over, what will I be doing? And some people say, I'm going to join the choir again, I'm going to sing again, or I'm going to go hiking again, or whatever you feel like. But you need to have a hope and a dream down the line to sort of feed this period that you're in right now so that your resilience is fed. Those are the 6.
That's a remarkable list. And I know that so many people who are going to be listening to this conversation, based on their own experiences, are going to quickly recognize how important this conversation really is. I would encourage people to find out more about ambiguous loss by visiting your website at ambiguousloss.com. I'm going to include a link to that site in today's show notes, along with links to your books, as I think they're remarkable in their own sense.
Thank you.
Dr. Pauline Voss, well, thank you so much for all the work you've done as a researcher, a clinician, and a teacher. To say you've been a difference maker would be a grand understatement.
Well, thank you. Stay healthy. Stay healthy as a caregiver. That's very important and not easy.
Well, thank you. And thank you for taking the time to talk with me today.
My pleasure.
Well, that's going to wrap up this episode of Real Talk MS. And before I let you go, I want to invite you to download the RealTalk MS app. You can download the iOS version of the app from the Apple App Store, and you can download the Android version from the Google Play Store. The app is free, and once you've downloaded the RealTalk MS app, you can go into the settings and decide how many episodes of the podcast you want to save to your phone, and every week the latest episode of the podcast will automatically download and be waiting for you. I decided to create the app to make it super easy for folks who may not regularly subscribe to podcasts to be able to access Real Talk MS every week without even having to think about how to do it. And the app allows me to share free bonus content with you. So in the coming weeks and months, I'll be able to share video content, written content. The app just gives us more ways to connect over meaningful content that I think you'll want to know about. So head over to the Apple App Store or the Google Play Store, download the Real Talk MS app, give it a test drive, and let me know what you think. I'm John Strum. Thanks for listening, and we'll catch you next time.